My name is Rosalyn Tate. I have been a charge nurse on the surgical floor at Morrow Valley Medical Center for 16 years, and I want to tell you about the Thursday morning that a woman I had never met came to the nursing station and asked for Nurse Kwan. Nurse Kwan, Delia Kwan, late 20s, black scrubs, quiet and efficient in a way that I had always associated with someone who came up through a rigorous program, had been on our floor for 14 months. She was the kind of nurse you notice after a few weeks because she is never in the wrong she anticipates. She does not wait for things to become problems. I had watched her work for 14 months and I had formed a high opinion of her, and I want to tell you that I had formed this opinion without knowing anything about where she had come from. That was Thursday's correction. The woman who came to the station was perhaps 60, well-dressed in the way of someone who travels frequently and has learned to do it simply. She had Delia's cheekbones. She introduced herself as Dr. Margaret Kwan, and she said she was looking for her daughter. I told her Delia was in room 412, and I would let her know she had a visitor. Dr. Margaret Kwan said, "Don't tell her I'm here yet. I wanted to ask how she is doing first." I said Delia was doing very well. I said she was one of the strongest nurses we had on the floor. Dr. Kwan said, "She's been worried about whether she chose the right thing. She came out of a surgical residency program to do this. I want to know if it was worth it." I said, "She left a surgical residency, Dr. Kwan. She had completed 2 years. She found she preferred patient care to procedure. Her father and I are physicians. We had opinions about the choice." She paused. I would like to know if she was right. I told her, and I meant every word of it, that Delia Kwan was one of the most clinically capable nurses I had supervised in 16 years. I told her that Delia's pattern recognition and post-op assessment was at a level I associated with nurses who had 20 years of floor experience. I told her about the morning in September when Delia caught a developing anastomotic leak at 3 in the morning before any monitor had flagged it, and the patient had gone back to the OR in time and had been discharged 11 days later. I told her that her daughter had not made a wrong choice. Dr. Kwan listened to all of this. She did not write anything down. Then she said, "Thank you." I went to room 412 and told Delia her mother was here. Delia's expression was the expression of someone who is both entirely unsurprised and entirely moved at the same time. She said, "How long has she been here?" I said, "About 8 minutes." Delia said, "Was she interrogating you?" I said, "A little." Delia straightened her scrubs, said, "I'll go get her," and walked down the hall. I watched her go, and I thought about the 2 years of surgical residency she had completed and left, and the question of whether she had chosen correctly. I had answered that question before I knew there was a question. I had formed an accurate opinion of Delia Kwan based entirely on watching her work, without any context for how much she had given up to do it. She had chosen correctly. Her mother came back to find that out in person. I thought that was worth knowing.